All right, let's talk about it. Men's health. It can be kind of awkward, right? But it really doesn't have to be. So, in this explainer, we're going to build a practical guide to help turn what's often a really tough conversation into one you can walk into with total confidence. Let's dive in.
So just think about it for a second. What's the one thing you'd kind of dread bringing up with your doctor? Is it something to do with sexual health, maybe urinary issues, or fertility? Hey, if you hesitated even for a moment, you are definitely not alone. The whole goal here is to arm you with the right information so those conversations become way, way less daunting.
Here's our game plan for today. Think of it as our consultation roadmap. First, we'll talk about just getting the conversation started. Then, we'll navigate through some key areas like sexual health, prostate health, and fertility. And we'll wrap it all up with a clear blueprint for you to really take charge. Okay, so let's kick things off with a really simple, but honestly, a pretty powerful idea. The source material for this whole thing? It's actually a guide that was written for doctors, but we're going to flip the script. We're turning it into a prep tool for you, the patient. So let's be super clear on this one point. We are not here to give you medical advice. Not at all. What we are here to do is, well, to show you the map of the conversation. It's all about demystifying the whole process. Once you understand the kinds of questions your doctor is probably going to ask, and more importantly, why they're asking them, you can walk in there so much more prepared. It just makes for a way more productive and, frankly, a much less stressful visit. So, let's see how this actually works. We'll jump into our first major topic, erectile dysfunction, or ED. It's one of the most common health issues for men out there, and yeah, it's often one of the toughest to bring up.
First things first, what are we even talking about? Well, the definition is pretty straightforward. ED is simply when someone has a hard time getting or keeping an erection. The key things to know are that it's incredibly common, and it's not always just a physical thing. Psychological factors can play a huge role too.
So, this is where the map comes in handy. This is likely one of the very first questions a doctor will ask. And why? Well, they're trying to figure out the potential cause right from the get-go. If it started suddenly, that might point to a psychological trigger. But if it was more gradual, that often suggests an underlying physical or medical condition.
And then, the questions get a little more specific to narrow things down. See, the difference between getting an erection versus maintaining one can actually point to different root causes, like problems with blood flow versus issues with nerve signals. It's all about building a really complete picture of what's going on.
And this is a huge question. Think about it. If it only happens in certain situations, it could be related to something like performance anxiety or stress. But if it's happening all the time, even with things like morning erections, then it's much more likely to have a physical cause. You see how these questions create a logical path to a diagnosis?
Okay, pay attention here because this is really, really important. Your doctor is going to be listening for these red flags, and you might wonder, what's the big deal? Well, it's because ED can sometimes be an early warning sign, like a check engine light for other, more serious conditions. Chest pain could signal heart disease. Weakness or vision changes, that might point to neurological problems. This isn't just about sexual health, this is about your overall health.
So what happens after you've had the conversation? It's not some big mystery. A typical management plan is a pretty clear, step-by-step process. It'll start with a basic physical assessment, then move on to blood tests to check for things like diabetes or low testosterone. From there, it's about looking at medication options and, crucially, making some lifestyle changes. It's a totally manageable path forward.
Okay, let's keep going. Now we're moving on to prostate and urinary health. This is another area where knowing the why behind the doctor's questions can make a world of difference.
I love this slide because it's basically a decoder for your doctor's questions. For instance, when they ask how often you're getting up at night to pee, they're not just curious about your sleep. They're actually assessing your bladder's function and capacity. And those questions about a weak or interrupted stream, that's them looking for telltale signs of an enlarged prostate, a really common condition also known as BPE, which can squeeze the urethra. Every single question is a specific diagnostic tool.
And just like with ED, there are some critical red flags here too. Visible blood in your urine? Never, ever ignore that. Things like unexplained weight loss or bone pain could signal something more serious is going on. And being completely unable to pass urine? That's a medical emergency. These are the kinds of symptoms that need immediate attention, no question. All right, on to our fourth section, fertility. I know this can be a really sensitive and stressful topic for a lot of people. So let's try to demystify one of the most common first steps, which is the semen analysis. The process itself is very specific, and laying it out like this can help reduce some of the anxiety around it. There's a required window of abstinence to make sure the sample is optimal, a specific way to collect it, and a really strict timeline for getting it to the lab. Following these steps perfectly is absolutely key to getting an accurate result.
Now you might get the results back and, whoa, those terms can look pretty intimidating with all the clinical jargon. But let's just translate a couple. If you see a word like oligozoospermia, don't panic. It simply means a low sperm count. Azoospermia? That means no sperm were found in the sample, which would mean an immediate referral to a specialist. The key thing is that each result has a clear next step.
And this is exactly how a good conversation with your doctor should go. They shouldn't just be throwing complex medical terms at you. They'll translate them into plain English, explaining exactly what the results mean for you. And listen, don't ever hesitate to just say, hey, can you explain that in a different way?
Wow, we have covered a lot of ground. So let's bring it all home in our final section, your proactive health blueprint. These are the key takeaways you can use starting today to take charge of these conversations.
Seriously, think of this slide as your personal cheat sheet for a better doctor's visit. Number 1, be honest and be detailed. It's the fastest way to get the help you actually need. Always remember how much of an impact lifestyle has, and please never ignore those red flag symptoms. But maybe most importantly, remember that these issues are super common. There are clear plans for managing them, and you are definitely not alone in this.
So we're going to end with this question for you. Now that you've seen the roadmap, you understand the why behind the questions, and you know there are clear next steps, what's the one conversation you feel just a little bit more prepared to have? Whether it's with your doctor, your partner, or maybe even just with yourself, starting that conversation is without a doubt the most powerful step you can possibly take.